Alright, this video is for anyone who wants to watch it. I recently underwent a colonoscopy in order to get some kind of diagnosis for some things I'm having. And the symptoms I've been showing were for Crohn's or ulcerative colitis. Basically, through the colonoscopy, they saw that I had bleeding ulcers in my intestines. And I've been for about 6 months now. So this is just a video about my experience. I started having problems when I was 16. It happened for a couple of weeks, and it wasn't as painful as it is now, and it just kind of shocked me. And I kind of told some people, but I forgot about it. It happened for a couple of weeks, and then it didn't happen for quite a few years until now. I'm 19 now, and since I think about 6 months ago, it didn't start heavy, like it gradually took on. I started bleeding, and I would just start to feel sick in my stomach, like really badly. Like it wasn't period pain. I just felt it all the time. I thought it was normal, but I guess it wasn't. So I waited for a long time. I waited for a few months before I finally started bleeding a lot. And then I let my parents know, and I got an appointment with my doctor. And they weren't too worried about it at first. They didn't exactly know how much it was bleeding. But I got kicked out of my house actually, and ended up getting kicked out for smoking weed. And I got kicked out of my house. And after I got kicked out, and I was living with one of my friends. I ended up bleeding so much I went to the hospital. It was pretty scary. Like it was just blood. There was nothing but blood coming out, and it scared the crap out of me. Doctors weren't that worried about it, so they prescribed me prednisone, which is a type of steroid and anti-inflammatory drug. And the steroids worked really well. I only took them for a couple of days, and I just took basically an anti-diarrheal called Imodium. And that kept me going through work, basically. But the symptoms were still really bad at work once I ran out of medication, and I had to substitute with cheaper drugs. And once I had been to a hospital, the doctor had taken me seriously. And after a shit ton of confusion, which I don't want to go into because it just makes my brain hurt every time I think about the confusion I've been through, as far as the gastroenterologist, the person who does colonoscopy. There was a lot of confusion there, but they got me to see one. They did some blood tests. Blood tests came back normal. Stool samples came back normal. So it wasn't food poisoning like everyone was telling me it was. And it wasn't cancer. It's not AIDS. It's not an autoimmune disease. Everyone was like, oh, you're just stressed. It's just caused by stress, and you need to change your diet. No, I don't need to change my diet. No, it's not because I'm stressed. I've been having this for 6 months. But anyways, after all the blood tests, I was done. Like, I didn't even want to go back to the doctors because I knew there was going to be a bunch of bills to pay. There are a bunch of bills to pay. I've got about $1,200 in bills to pay. I don't like this. But, I got the colonoscopy. It was really nice. The nurses were really hot. And I was so happy about that part. Like, the lady who drugged me up and, gave me the medication, God, she was so hot. That was just like the best part about all this is some really hot nurses got to see my ass. I'm a little bit okay with that. I'm sorry I was knocked out for it all. But anyways, through the pictures, they saw that I had ulcers. And right now they're giving me the diagnosis of ulcerative colitis, but truthfully, they sent in a biopsy that they cut out for the little part of my intestine. They're sending a biopsy to see if it's Crohn's or ulcerative colitis. Either way, the prognosis really sucks. Anyways, I'll post below a picture of me in the hospital with the thing in my hand to hate needles and just looking like a star. Thanks for watching.